Picture the intense, blinding lights of a modern operating room, the rhythmic, steady beep of the heart monitor. The surgeon holds out a sterile, gloved hand, and a gleaming silver scalpel is slapped perfectly into their palm. They use specialized retractors to open the tissue. They use precision forceps to clamp bleeding vessels. They use dissolving sutures to flawlessly close the wound, leaving nothing but a faint scar. When you picture the invention of these miraculous, life-saving tools, who do you picture? You are taught to revere the European medical renaissance. You are told that before European doctors brought science and rationality to medicine, surgery was nothing more than barbaric butchery. We are taught that for centuries, if you needed surgery in Europe, you did not go to a doctor. You went to the local barber. You went to an uneducated man who cut hair, pulled teeth, and amputated infected limbs with a dirty saw. According to the Western textbook, humanity suffered in this medical dark age until brilliant European men, like the French surgeon Ambroise Paré or the Flemish anatomist Andreas Vesalius, miraculously woke up in the 16th century. We are told they single-handedly dragged surgery out of the blood-soaked barber shops and elevated it to a precise, sterile, highly respected medical science. We are told that the West alone figured out how to safely navigate the human body. But the absolute foundational blueprint for the modern operating room was not drafted in 16th century Paris. The precision silver scalpel was not invented in London, and the dissolving stitches that heal our deepest internal wounds were not discovered during the European Renaissance. The exact physical architecture of modern surgery was engineered over 500 years earlier by an Arab surgeon working in the gleaming palaces of Islamic Spain. This is the buried record, and today, we are peeling back the layers on the surgical heist, and how a 10th century Arab physician actually invented modern surgery. What follows is the story of a massive medical cover-up, and one of the most blatant acts of academic identity theft the Western establishment absolutely does not want you to know. If you are the kind of person who refuses to accept the heavily curated, highly sanitized historical narratives handed to you in school, if you want to know the actual, hidden architects of the modern world, you are in the right place. Hit subscribe. We dig into buried records like this every single day. Let us begin with the official timeline of medicine, the version of human discovery you were tested on, which meticulously paints Europe as the sole, undisputed savior of the human body. According to the Western narrative, the story of surgery is divided by a massive, bloody chasm. On one side, you have the ancient Greeks, like Hippocrates and Galen, who mapped basic anatomy but rarely performed complex internal surgeries. On the other side, you have the modern European Renaissance. Between those two eras lies the grim reality of medieval Europe. The Western textbook openly admits that European surgery was a horrific, deeply primitive trade. Real, university-educated European physicians considered themselves philosophers. They refused to touch blood. They refused to cut into the human body. If a patient had a tumor, a shattered bone, or a complicated childbirth, the elite European doctors would step away and hand the patient over to the barber-surgeon. These European barbers had no knowledge of anatomy. They had no understanding of infection. They operated with crude, unsanitized knives and massive, rusted saws. To stop bleeding, they would violently press boiling hot oil or red-hot iron directly onto the open wound. It was a chaotic, agonizing gamble, and the death rate was catastrophic. The standard textbook narrative tells us that this nightmare paralyzed human progress until the miraculous dawn of the European medical awakening. Suddenly, in the 1500s, the West claims absolute authorship over surgical salvation. Andreas Vesalius begins illegally dissecting human corpses to map the vascular system. Ambroise Paré, a French battlefield surgeon, supposedly realizes that pouring boiling oil on wounds is a bad idea, and he begins using thread to tie off bleeding arteries. The West completely crowns itself. Europe boldly declares that the concept of precise surgical instruments, anatomical mastery, and compassionate surgical care is the pure, unadulterated invention of the European mind. They draw a straight, unbroken line from the dark ages of the barber-surgeon directly to the pristine operating theaters of Europe, completely ignoring a massive, glaring, 500-year gap in the timeline. But if you actually dig into the historical archives, if you look at the physical tools sitting on the silver trays of those European surgeons, and if you trace the medical techniques they were supposedly discovering back to their absolute origins, that beautiful, isolated narrative of Western medical genius completely shatters. To find the true father of modern surgery, and the original inventor of the operating room, we have to completely abandon the freezing, disease-ridden streets of medieval Europe. We have to travel back in time, over 5 centuries before the European Renaissance even began. We have to travel to the beating heart of Al-Andalus, the massive, glittering city of Cordoba, in Islamic Spain, in the 10th century. In the 900s, while London and Paris were built of mud and timber, Cordoba was the most advanced, heavily populated, and intellectually wealthy city in the world. It had paved roads, street lamps, running water, and massive state-funded hospitals. And serving in the royal court of the caliph was a brilliant physician named al-Qasim Al-Zahrawi. Al-Zahrawi was entirely different from the elite physicians of Europe. He did not believe that touching blood was beneath his dignity. He looked at the primitive, brutal practices of the era and completely rejected the idea that surgery was just a bloody trade for uneducated butchers. Long before the European Renaissance supposedly invented surgical science, Al-Zahrawi declared that surgery was the absolute highest pinnacle of medicine. He argued that you could not simply cut into a human being based on guesswork. He demanded that a surgeon must possess absolute, flawless mastery of human anatomy before ever picking up a blade. But Al-Zahrawi faced a massive, terrifying problem. He possessed the anatomical knowledge, he possessed the brilliant medical theories, but when he looked at the physical tools available to him, he realized they were completely insufficient for the complex, delicate internal operations he wanted to perform. The ancient world simply did not have the tools required to safely navigate the intricate vascular systems and delicate organs of the human body. So, Al-Zahrawi did not just theorize about surgery. He became a master engineer and a metallurgist. He walked into the forge, and he physically built the modern operating room from the ground up. He dedicated his entire life to observing, experimenting, and operating. And after decades of relentless surgical practice, he compiled his massive, unparalleled medical knowledge into an absolute masterpiece. He wrote a colossal 30-volume medical encyclopedia titled Al-Tasrif. The final volume of this massive work was entirely dedicated to surgery. And inside this single volume lies the absolute, undeniable proof that the West did not invent modern surgery. They copied it. Because in this book, Al-Zahrawi did not just describe medical theories. He literally drew, engineered, and detailed the exact manufacturing instructions for over 200 unique, specialized surgical instruments. He was about to forge the silver tools that would save millions of lives. Before the 10th century, surgeons operated with whatever crude, unspecialized blades they could find. A knife used to cut meat might be used to amputate a leg. But inside the pages of Al-Tasrif, Al-Zahrawi introduced a level of mechanical precision that the medical world had never seen. He engineered and illustrated highly specialized scalpels, each perfectly weighted and angled for specific, delicate incisions. He invented the surgical retractor, a mechanical tool designed to safely pull back tissue and hold an abdomen open during surgery without crushing the organs. He invented the modern surgical forceps, originally engineering them with semicircular jaws to safely extract a dead fetus from the womb and save the mother's life. He invented the syringe. He invented specialized bone saws, drills, and the precise instruments required to crush and extract incredibly painful bladder stones. He invented the tools required to safely perform a tracheotomy. He designed concealed surgical knives to avoid causing panic in terrified patients. He took the chaotic, bloody guesswork of ancient medicine and forced it into a rigorous, highly disciplined, mechanically precise physical environment. But his absolute greatest surgical breakthrough was not made of silver or steel. It was biological, and it solved one of the deadliest problems in the history of medicine. When a surgeon cuts deep into the internal organs of the human body, they eventually have to sew the patient back together. In the ancient world, and in medieval Europe, if a barber surgeon attempted to stitch internal tissue, they used regular cotton, silk, or linen thread. But the human immune system recognizes these threads as foreign objects. The body violently attacks the stitches, causing massive internal infection, rotting the tissue, and almost universally killing the patient in agony. If the patient miraculously survived, the surgeon would have to brutally rip the infected stitches back out. Al-Zahrawi needed a material that was strong enough to hold human organs together, but biological enough that the human immune system would accept it. He began observing the natural world, and he made a world-altering discovery. He realized that the spun intestines of sheep and livestock, a material known as catgut, possessed a miraculous property. When catgut was used to stitch internal human tissue, the body did not reject it. Instead, over a period of weeks, the human body would naturally, safely, dissolve and absorb the animal tissue. Al-Zahrawi had just invented the dissolving internal suture. Let the absolute magnitude of that medical breakthrough sink in. If you, or anyone you love, has ever had an appendectomy, a cesarean section, or deep internal surgery, the surgeon closed the internal wounds using dissolving sutures. The exact biological mechanics of that life-saving stitch were discovered and perfected by an Arab surgeon in the 10th century. And crucially, Al-Zahrawi did not keep these world-altering tools a secret. He meticulously drew every single instrument, explicitly detailing how to forge them, how to hold them, and exactly how to use them on the human body. Al-Tasrif was not just a textbook. It was the absolute first illustrated surgical manual in the history of the world. So, a massive, terrifying question emerges for the defenders of the European medical renaissance. If the precise silver scalpels, the surgical forceps, the retractors, the dissolving catgut sutures, and the exact protocols for complex internal surgery were all invented, illustrated, and thoroughly documented by an Arab surgeon in 10th century Spain, how did European men like Ambroise Paré and Andreas Vesalius get all the credit? How did the West successfully execute this massive medical cover-up, claiming they invented modern surgery out of thin air in the 16th century? To answer that terrifying question, we have to completely dismantle the myth of the isolated European medical genius. We have to look at the massive, highly organized, and deliberately obscured academic extraction network of the Middle Ages. You are taught that the European medical awakening was a closed intellectual loop. You are told that in the 1500s, Western surgeons simply woke up, looked at the human body rationally, and spontaneously invented precise surgical tools. The Western narrative violently insists that the architecture of modern surgery is a purely European invention, completely untainted by the outside world. But the physical and geographical reality of the Middle Ages destroys that myth completely. In the 11th and 12th centuries, Christian Europe was medically starving. European kings and nobles were dying of easily treatable wounds because their barber-surgeons were utterly incompetent. But just across the Pyrenees Mountains, the libraries of Islamic Spain were overflowing with centuries of highly advanced Islamic medical science, including the massive 30-volume encyclopedia of Al-Zahrawi. As Christian armies began to conquer cities in Islamic Spain, like Toledo, European scholars were utterly stunned by the medical wealth they found. They immediately launched one of the most aggressive, large-scale technological and intellectual transfers in human history. A prolific Italian translator named Gerard of Cremona traveled to Toledo. He found the massive, illustrated surgical volume of Al-Tasrif. Recognizing that this book was centuries ahead of anything in Europe, he furiously translated the entire surgical manual from Arabic into Latin. When this Latin translation hit the freezing, medically primitive universities of medieval Europe, it did not just cause a ripple, it caused an absolute medical supernova. European medical schools, which had been completely paralyzed by the bizarre theories of ancient Greeks and the brutal incompetence of barber-surgeons, suddenly held in their hands a flawless, mechanically precise manual on how to physically operate on the human body. They were looking at exact, scale drawings of over 200 surgical instruments. They were reading the exact instructions on how to use dissolving catgut. Al-Zahrawi's translated text became the absolute, undeniable, mandatory surgical foundation for every single European medical school, including Salerno, Montpellier, and Padua, for the next 500 years. But the Western academic establishment had a major, terrifying ideological problem. They were actively engaged in massive, bloody crusades against the Islamic world. They were pumping out heavily funded propaganda, telling the European public that the East was backward, barbaric, and utterly incapable of rational scientific thought. They were building an empire based on the absolute supremacy of the Christian European mind. They could not publicly admit that the greatest, most advanced, most heavily studied medical text in their prestigious universities was written by an Arab Muslim. It would completely destroy their fragile narrative of Western intellectual dominance. So, they engaged in a deliberate, highly calculated process of academic identity theft. The European establishment could not pronounce, or deliberately chose to obscure, the Arabic name Abu al-Qasim al-Zahrawi. So, they completely altered it. They Latinized it. They took the absolute greatest surgeon in the history of the human race, stripped away his Arabic name, stripped away his Islamic context, and rebranded him to the European public simply as Abulcasis. By changing his name to Abulcasis, the European academic establishment turned him into a vague, mythical figure. Over the centuries, many European medical students reading this translated surgical manual completely forgot, or were deliberately never taught, that the author was a 10th century Arab. They simply assumed Abulcasis was just another ancient Greek or Roman physician, safely belonging to the acceptable Western intellectual lineage. The West completely absorbed the brilliant, perfectly engineered surgical science of the Islamic Golden Age, slapped a Latinized name on the cover, and quietly erased the original author from the mainstream historical timeline. This massive, highly successful identity theft set the perfect stage for the ultimate medical heist. By the time the European medical renaissance actually began in the 16th century, The physical foundation of the operating room and the engineering of the surgical tools had already been completely solved by Al-Zahrawi. The heavy lifting was entirely done. The blueprints, the instrument designs, and the surgical protocols were already sitting right there in the European medical libraries, fully translated into Latin, falsely credited to Abulcasis. So, when the iconic, undisputed heroes of Western medicine began to make their groundbreaking discoveries, what were they actually doing? Were they inventing a new science out of the darkness? Or were they simply walking into an operating room that an Arab surgeon had already built for them? When you actually look at the physical operating rooms, the surgical textbooks, and the explicit medical protocols of the undisputed heroes of the European medical Renaissance, the illusion of isolated European genius completely evaporates. They were not inventing a new science out of the darkness. They were directly, heavily, and undeniably building their entire surgical empires on the physical and mechanical bedrock laid by a 10th century Arab surgeon. Let us look at Ambroise Paré. The Western world worships Paré as the ultimate father of modern surgery. We are taught that his brilliant, compassionate mind elevated battlefield surgery in 16th century France. We are told he was the visionary who stopped pouring boiling oil on wounds and instead used threads to tie off bleeding blood vessels, a process called ligation. But when Ambroise Paré was operating on French soldiers, what tools was he actually holding in his hands? He was holding scalpels, forceps, and retractors, whose exact mechanical designs had been finalized by Al-Zahrawi over 500 years earlier. Furthermore, the very concept of tying off blood vessels to stop bleeding, the exact technique that supposedly made Paré a legend, was explicitly detailed and illustrated by Al-Zahrawi in Al-Tasrif centuries prior. Ambroise Paré did not invent the modern surgical toolkit. He did not invent vessel ligation. He was simply utilizing the translated, Latinized instruction manuals of an Arab genius, wielding the exact physical tools that the Islamic world had perfected centuries before he was born. Now, let us look at the broader surgical protocols of the European Renaissance. You are taught that the European anatomists were the first to perform highly complex, delicate procedures, such as crushing and extracting bladder stones, or safely performing a tracheotomy to open a patient's airway. We are told these were the absolute triumphs of Western medical rationality. But if you open the Latin translations of Al-Tasrif, written a staggering 500 years before the Renaissance, the exact, uncompromising protocols for these precise surgeries are sitting right there on the page. Al-Zahrawi explicitly detailed the anatomy of the throat and the exact angle of incision required for a tracheotomy. He explicitly engineered a specialized drill, called a lithotrite, to crush bladder stones without destroying the surrounding organs. The Western pioneers of surgery were undeniably skilled men, but they were not pioneers. They were the inheritors of a massive, heavily translated, highly advanced Islamic medical architecture. But the intellectual heist goes even deeper than simply ignoring Al-Zahrawi's contributions. The Western academic establishment actually weaponized the translation process to completely strip the Islamic world of its greatest medical discoveries. By the 13th and 14th centuries, the Latinized texts of Abulcasis were so incredibly famous and so universally respected in European medical universities that his surgical chapters were bound alongside the works of the ancient Greeks, Hippocrates and Galen. They were literally the undisputed laws of surgery in Europe. But as the European medical establishment grew in power and prestige, they began to construct a narrative of continuous, unbroken European medical supremacy. In the modern era, when Western medical historians looked back at the massive body of work translated from Abulcasis, they saw the brilliant, flawlessly engineered surgical instruments. They saw the detailed instructions for complex internal operations and the revolutionary use of catgut sutures. But instead of accurately crediting the 10th century Arab Muslim, the Western historians made a highly calculated, deeply prejudiced omission. They simply stopped mentioning him. They took the massive, undeniable genius of Al-Zahrawi and quietly scrubbed him from the curriculum. They dropped his Latinized name, Abulcasis, from the medical textbooks. They took his revolutionary discoveries about surgical tools, ligation, and dissolving sutures, and they simply reassigned the credit. They gave the surgical awakening to Paré. They gave the anatomical mastery to Vesalius. Do you see the absolute arrogance of the heist? First, they Latinized his name to strip his Arab identity. Then, they copied his surgical tools and his operating protocols to build their own medical revolution. And finally, when the brilliance of the science was undeniable, they simply erased Al-Zahrawi from the timeline of human discovery, passing off his engineering as the spontaneous, miraculous invention of the Renaissance mind. They took the absolute foundation of modern surgery, smashed the Arabic name off the operating room door, and slapped a European patent on it. They built the modern medical world on a stolen blueprint. Today, we live in a world where complex surgery is a daily miracle. We build massive, multi-billion-dollar hospitals and research centers. We revere institutions like Johns Hopkins and the Mayo Clinic as the ultimate, unquestionable pioneers of human health. We sit in medical school lecture halls and nod along as professors praise the unique, unparalleled, isolated genius of the European medical renaissance. We are told that the West alone crawled out of the darkness of the barber-surgeon and figured out how to safely navigate and heal the human body. But the modern surgical mind was not born in a 16th century Parisian hospital. The precision silver scalpel was not forged in London. The dissolving stitches that heal our deepest internal wounds were entirely awakened, shaped, and permanently defined by a Muslim surgeon in 10th century Cordoba. Modern surgery is not a spontaneous European miracle. It is a massive, highly successful medical heist. The West didn't invent the operating room. They simply walked into an Islamic hospital, took the silver instruments off the tray, stole the catgut thread, and then convinced the rest of the planet that they had invented the very concept of surgery. Everything you just heard is documented. The massive, undeniable presence of the translated Arabic surgical texts in the libraries of medieval Europe is a physical reality. The exact structural blueprints for the scalpel, the retractor, and the forceps are sitting right there in Al-Zahrawi's original 10th century Al-Tasrif. The undeniably mapped use of dissolving catgut sutures by an Islamic surgeon centuries before Europe even knew what they were is an undisputed historical fact. The question isn't whether it's true. The question is, why is the true father of surgery and the inventor of the modern operating room deliberately kept out of your textbook? If this completely shattered how you see the medical renaissance, the birth of surgery, and the myth of Western intellectual supremacy, share it with someone who needs to hear this. The buried record demands the truth. Subscribe, and we will keep digging.